is inclusive of Asian American networks, and we are an ACL-funded technical assistance and resource development center. And it's a great honor to have some esteemed panelists joining us today for a very important conversation. We all know that the overwhelming majority of older adults in this country want to age in place in their own homes and communities. So this is a very important conversation and in terms of how to make that happen by creating opportunities and options for accessible and affordable housing for older adults. So welcome everybody. We're hoping to make this a very interactive conversation. I will begin with a few questions for our panelists, and then I will invite members in the audience to join in. You can either type your comments or questions in the chat or raise your hand, and I will call upon you to contribute to this conversation. All right, so beginning with some quick introductions for our panelists, we have with us Jeff Smith, who is Executive Director of the Institute for Housing Studies at DePaul University. We have Molly French, who is Project Director for Housing and Services at US Aging. And we have Jenny Kai, who is Senior Attorney at Justice in Aging. So Jeff, Molly, and Jenny, as I ask each of you your first questions, feel free to add a little bit more about yourself as well as the organization that you're representing today. All right, with that, I'm going to go ahead and begin with my first question for Jeff. So Jeff, I know that you've been leading research on housing accessibility, affordability for seniors. Can you tell us a little bit about what some current demographic and economic characteristics and trends are that affect older adult housing needs, specifically in Illinois?
Certainly. Thank you for the opportunity and the introduction. Just a little bit of additional background on the Institute for Housing Studies. We're an applied research center based at the College of Business, Department of Finance and Real Estate at DePaul. IHS, we like to lead with the fact that we're applied. So all the research and data we produce is really oriented towards informing the work of practitioners who are trying to understand different components of the housing market, be it related to demand for housing or the supply of housing that affect affordability for different types of households, different types of communities. And one of the key topics that we've really focused on over the last few years has been this issue of the implications of an aging population and how that demographic trend is going to affect housing needs in different communities in Chicago and for different populations in the city and the broader region and state. So yeah, big picture, one of the key things I think that will not come probably as a surprise to anyone is that older adults make up really the most rapidly growing component of the population. This is true nationally, it's true in the state, it's true in Illinois. If you look at research from the Joint Center for Housing Studies out of Harvard University, the population of older adults has increased by 34% over the last decade or so, and is expected to grow even more rapidly in the coming years. By 2024, the number of households headed by an older adult or someone over 80 is expected to double. So again, a growing number of households headed by older populations. And in Cook County, we've seen the same thing, essentially the same trends mirrored. A couple of the things that I think are somewhat unique, that might be worth calling out is, typically older adults tend to be homeowners, and so the significant share of older adults own their homes. But there is a growing share of older adult renters. And I think that especially older adult renters of color has been a growing, kind of trend in the city of Chicago. So understanding sort of how to maybe address some of the concerns related to aging in place and naturally occurring or unsubsidized affordable rental housing is a big issue that folks are trying to figure out. So yeah, I can get into more details for sure as the panel progresses, but yeah, definitely just a growing number of older adults and a growing demand for solutions for aging in place for those older adult homeowners.
Thanks, Jeff. So another question that we had for you is, what are current housing affordability and supply challenges that can inform future planning to meet the housing needs of the aging population in Illinois?
So yeah, I think so there's a few ways to answer that. But I think one of those just overriding kind of key challenges that the data has shown recently is if you look at the issue of cost burden,
Sorry about that.
that you know the share of homeowners that are cost burdened. So the cost burden is defined as, the number if you're paying more than 30% of your income towards housing costs, you're considered cost burdened. Um, Typically, homeowners have lower levels of cost burden than renters, but what we've seen in recent data is that the share of owners that are cost burden has grown for lower income owner occupied households, right? So, and these are typically households without a mortgage. And so the data can be sliced and diced in a few different ways, but that tends to mean older adults, right? So we're seeing a growing share of older adult homeowners experiencing cost burden. And this is really a product of growing non-mortgage costs. So this is increases in property taxes, increases in insurance, increases in utilities, increases in home improvement, requirements. As those costs increase, and incomes, most older adults have low and probably fixed incomes. Those incomes aren't increasing. That's what's triggering this increasing cost burden for older adult owners and potentially threatening housing stability for those older owners, which is challenging because as we know, as you age, you have modification requirements potentially, especially in a city like Chicago. A lot of the housing stock is old. If you live in a single family home, if you live in a two flat, you're likely going to have stairs. You're likely going to have, just ongoing home maintenance needs just to ensure that the property is in good condition. And if you have, your available income is eroding, if your home equity hasn't necessarily increased, if you have a challenge accessing that home equity through a mortgage, there's going to need to be, resources available to help those modest income older adults make the necessary modifications to their home, make the necessary improvements to their home so they can age in place comfortably, so they can protect the value of that asset, which is really important to transfer that wealth to your family. So I think that that's a key challenge on the housing supply side, is that you have a lot of older adults living in older housing that need improvements, but the resources to support those home improvements are unfortunately very limited.
Thanks, Jeff. So that's a really good big picture overview of what's happening in the state. I do see that we have some of our community partners that have joined this meeting. So if you don't mind, I'm going to call upon you to share with us what you've heard in terms of, stories, concerns, complaints from some of your senior clients that kind of adds some nuance or provides more detail to the big picture issues that Jeff shared. So you can raise your hand, and if I don't see anybody raising their hands, I might call upon one or two people. Radhika, I see your hand raised. Please go ahead.
The biggest challenge that we are facing with our population is we have a lot of seniors that want to not live with their children anymore, or they're looking for senior housing under Section 8, and the wait time, typically not in Cook County, I'm talking about DuPage County and Will County, counties that I serve and process, they're like a minimum of 3 years. So they have to be on the wait list for 3 years even before something opens up. So even if they submit an application, they apply online, they don't have any availability. And sometimes it's an emergency situation where they want to have their own home. They either need to get out or they just have to find something to live in. And 3 years is like a long time. We often have seniors coming up and saying that, oh, I don't know what's going to happen to me in 3 years, especially if they're in their early 80s and stuff.
Thanks for sharing, Radhika. And just to add a little bit of context to Radhika's comment, so Radhika is with Metropolitan Asian Family Services. A lot of their clients are Asian, South Asian, with a history of intergenerational living, but now it sounds like people are wanting to have their own separate housing accommodation. So that's an important trend, I think, for us to be aware of. And then I see Scott with their hand raised.
Yes, thank you. A trend that we're seeing, it's not necessarily housing. I'm with AgeLink. We're the area agency on aging for Lincoln Land. We're in central Illinois. We cover 12 counties. Is assistance with utility bills. We get calls almost on a daily basis of individuals needing help with to pay their utility bills. So and also rent. So that's one of the biggest struggles that we're dealing with here in central Illinois. I just thought I'd share that with the rising cost of utility bills, especially.
Thanks, Scott, for sharing that. And I think that obviously is going to increase the burden on seniors living on fixed incomes and trying to age in place. So thank you for that comment. Molly, I wanted to ask you, do you hear similar stories at the national level? Because I know that you are deeply connected with the network on area agencies on aging.
Thank you, and thank you for having me. Yes, I would say housing and homelessness are among our members' top concerns. And just as a gentleman from AgeLink spoke about, the so many older adults are getting priced out of their housing. It's there, and Jeff also addressed this. So there can be some assistance. It varies in terms of utilities. I can drop some of those in the chat after I finish, so I'm not.
Right. Yeah.
And I would also say US Aging, we're the National Association of Area Agencies on Aging, or AAAs. And we also provide a voice in nation's capital for the Title VI Native American Aging programs. So in addition to kind of the concerns that were raised, I would say there can be local, for the older adults who are homeowners, make sure if you're a service provider, you're aware of any local property tax relief. It doesn't necessarily address the utility assistance nor rental assistance, but it would address, provide some relief in terms of household expenses. And beside the other point to just, help build everyone's awareness, and I can provide another link in the chat, is that in addition to the federally subsidized housing, there is, for example, there's the HUD Section 202 buildings that are specifically targeted for older adults. There are a lot of other affordable housing providers. So I will drop in the chat a link to find some of that broader range of subsidized housing. But yes, the wait times are very long.
Thanks, Molly. And just so the audience knows, we will be compiling all resources that are shared in the chat, and we will email it out to everybody who was registered for the webinar. So if anyone else has resources or other useful information to share, feel free to drop it in the chat. All right, so I'm going to move on now to my next set of questions, which are for Jenny. And these questions are more about, the importance and the need for advocacy efforts. Jenny, you're with Justice for Aging, and that is one of the main activities that your organization is involved in. So, what are some advocacy efforts that you guys are involved in to advocate for meaningful, affordable, and fair housing for older adults?
Yeah, thanks for that question. And so I'm from Justice and Aging, and we are a legal advocacy organization, and we advocate for low-income older adults. And our substantive work focuses on health, economic security, elder justice, and housing. And Justice and Aging, we expanded into doing housing work a few years ago because of the alarming rise in older adult homelessness. And I know Jeff mentioned the growing number of older adults in general. And also nationally, older adults are the fastest growing group among people experiencing homelessness. And so our housing advocacy overall is really focused on preventing and ending older adult homelessness. And we also really focus on older renters. And so I'll provide two examples of housing advocacy that we're involved with. The first example is we advocate for protecting and extending federal rental assistance programs, which I know we've been talking about, like HUD's Housing Choice Voucher Program, which is the country's largest federal rental assistance program and serves the largest number of low-income older adults. And the second example is we advocate for equitable access to those programs and housing in general for older adults, which is where our fair housing advocacy comes in. So for the first part, in terms of federal rental assistance, I know we've been talking about how so many older adults are living on fixed incomes like SSI or Social Security, and these benefits really have not kept up with rising rents. And as a result, many older adults are becoming homeless for the first time after age 50. And for these older adults, a lot can't afford housing unless they have federal rental assistance that covers that gap between what people can afford to pay and what their rental costs are. But unfortunately, only about 1 in every 3 older adults who needs federal rental assistance receives it, because federal rental assistance is a lot. Can't afford housing between.
So, members in the audience, please make sure that your mics are muted. Thank you.
Thanks. And so, as I mentioned, only 1 in 3 older adults who needs federal rental assistance receives it, because federal rental assistance is not an entitlement program where everyone who is eligible can receive benefits. And federal rental assistance is also very underfunded by Congress, which is what results in these long wait times like we've been talking about. And I think the levels of federal funding are actually at the lowest they've been in about 20 years. So that's a major problem. And we work in coalition with other partners to try to ensure that the federal government protects and expands these programs so that hopefully in the future, everyone who needs federal rental assistance can receive it, including, of course, low-income older adults. So that was federal rental assistance. And for the second example of our housing advocacy, like I mentioned, we do a lot of work around fair housing and equitable access to housing. And so that involves advocacy to strengthen federal civil rights and tenant protections, to prevent housing discrimination and make sure that all older adults have equal access to housing. And fair housing is extremely important for older adults, especially when you're talking about accessibility issues and older adults with disabilities. So, for example, under fair housing laws, landlords should grant reasonable accommodations and modifications that are necessary for people with disabilities to have equal access to housing. So a very common situation is older adults with disabilities. They may need a live-in aid or a service or emotional support animal, and they may need their housing providers to waive certain policies as a reasonable accommodation. And then also housing providers, they generally have legal obligations to ensure that properties and units are physically accessible for people with disabilities. And so they may have to provide or allow structural reasonable modifications like the installation of ramps or grab bars. So these are just some examples of the types of issues that we focus on. And if you would like to learn more, I encourage you to go to our website, which is justiceandaging.org.
Thanks, Jenny. A quick follow-up for you. Is there a way for seniors or some of the senior serving agencies that have joined us today to be involved in these advocacy efforts?
Yeah, so at Justice and Aging, we have a weekly newsletter where we provide news about federal updates, things that are going on at the national level. And in that newsletter, we often include advocacy opportunities, like opportunities to comment on
Right.
rulemaking from federal agencies or sign-on letters, things like that. So if you're interested, I encourage you to sign up for our email list so that you can stay connected to those updates.
If you get a moment later in the webinar or maybe after, if you could just send us a quick link that we can direct folks to sign up for that newsletter, we can definitely help share it.
Yeah, I can do that.
Great. I have another question for you. What can states do to promote accessible and affordable housing options for older adults?
Yeah, that's a great question, especially right now, because we're seeing this trend towards cutting federal investments in a lot of these programs. And so I'll talk about two issues. One is the importance of states investing in their own rental assistance programs. And I touched on this earlier, but a key driver for homelessness among older adults is that growing gap between people's income and their rental costs. And as I mentioned,
So another reminder to audience members to please mute yourselves because we're getting a bit of an echo here. And I'm going to go ahead and mute myself as well when I'm not talking.
hopefully, I think the sound is okay now. So as I mentioned, only 1 in 3 older adults who needs federal rental assistance receives it. So there is a big opportunity there for states to help fill that unmet need. And at Justice and Aging, we also do a lot of work in California. And in California, we've been advocating for the creation of a state-based rental assistance program targeted for older adults. And other states have similar types of programs. So in Delaware, for example, they have a state-based housing voucher program for older adults and people with disabilities who are at risk of institutionalization. Another example is in Massachusetts, which recently agreed to invest in funding more state-funded rental assistance and other supports. And this was after Justice and Aging and our partners brought litigation. And in that case, we represented older adults and people with disabilities who had been unnecessarily institutionalized in nursing homes. And a lot of these older adults, they were in nursing homes only because they had lost their housing in the community after not being able to afford their rents or not being able to physically access their housing due to mobility impairments or other disabilities. So basically, because of the lack of affordable and accessible housing in the community, they had ended up in nursing homes as a last resort. So as I mentioned, Justice and Aging, we and some of our partners, we sued the state of Massachusetts. It was an Olmstead case, and under a settlement agreement, the state will make significant investments in funding rental subsidies and subsidized housing units, home modifications, and other supports so that older adults and people with disabilities can live stably in the community and stay housed in the community. So state funding for rental assistance and other housing supports is really critical, and it's also more cost effective for states because homelessness and institutionalization is really costly for states, and all of that costs more than keeping older adults housed and preventing older adult homelessness. And then the second issue I wanted to talk about is fair housing enforcement, because states play a big role in fair housing enforcement, and local fair housing organizations and state civil rights agencies. In Illinois, it would be the Illinois Department of Human Rights. They enforce both federal and state fair housing laws, and most fair housing complaints involve disability discrimination, which is an issue often faced by older adults, like the denial of reasonable accommodations or modifications. So it is vital that older adults report housing discrimination and file fair housing complaints. And then it's critical for state-based fair housing organizations and civil rights agencies to educate communities, including older adults, about their fair housing rights, to help people with their fair housing complaints, and again, enforce fair housing laws so that older adults and other people who experience housing discrimination get equal access to housing. So to recap, state-funded rental assistance and enforcing fair housing laws, I think, are two great examples of what states and state-based organizations can do to promote accessible and affordable housing for older adults.
Great, thanks, Jenny. We do have a question from Tina Hall. Where would you file a fair housing complaint? So I suppose this would be with the Illinois Department on Human Rights.
Yes, and I would recommend that you get help from a local fair housing organization with filing the fair housing complaint. And I can find the link and put that in the chat later, but HUD, they fund fair housing organizations specifically to help people with fair housing complaints. And these organizations, they can either provide assistance or legal representation with fair housing complaints. And that's getting that support is usually helpful. And then the state civil rights agency will investigate the complaint.
Thanks, Jenny. I don't know if we have a state representative here, maybe from the Illinois Department on Aging. If we do have someone, this is your opportunity to add some comments about investments that the state is making for affordable, meaningful, accessible housing for seniors. It's hard for me to tell based on the names here, but anyone representing the state? Feel free to raise your hand or share your comments in the chat.
Hi, this is Michelle Hirsch. I am with the Illinois Department on Aging. I'm the new Chief Planning Officer for the Multi-Sector Plan on Aging. And while I can't answer all of what's going on within the department, I've been on the job for a total of 6 weeks. Let me just clarify. I am working with Community Advisory Council, and then also soliciting information, requests, ideas, recommendations, along with strategies. Not just here's the problem, but recommendations of strategies that we can incorporate in the multi-sector plan. The multi-sector plan, can I have just 1 minute to talk about that? Is that okay?
Yes,
Okay.
absolutely.
Okay, the multi-sector plan is an executive order by Governor Pritzker. It was signed last August. It included having convening a task force with representation from all across multi-sector, so almost every department within the state of Illinois. We are also working, of course, outside of the state of Illinois with a large community advisory council consisting of 25 experts from across the state, but that is far from where it ends. We are getting recommendations and engagement from all across the state. And so we will be putting out some requests for recommendations on strategies to address. So the four focal areas include livable and connected communities. So you can see how much we prioritize that. And the executive order was based on work that was started by the Illinois Aging Together Coalition and out of Health and Medicine Policy Research Group. And so they took their findings to the governor, and hence the executive order, which also resulted in addition to the task force, community advisory council, and many other requirements, that they hire me, I'm the chief planning officer. So that was a new role based on the executive order. So my sole purpose is to develop this plan. And as you can see, with focal area number 1 being livable, connected communities, that is a huge priority. Other of the 4 focal areas include healthy aging, investing in caregiving, and affording aging. And so it sounds like all of those fit very well into what you're talking about here today. So we are now going around the state doing, I'm based in Chicago, but I'm actually in Springfield because we had our first engagement session on Monday at the senior day at the state fair. But we'll be going around the state getting input from people with lived experience, individuals, from the community, and providers. And so I will make sure I just heard about this webinar a day or so ago. The Director Killo, thought it was very important for someone to be on, and I jumped at it because I need to learn about all of these housing issues. So I will respond to whoever is coordinating this with both the 2-page document that describes where we are with respect to the planning of the multi-sector plan on aging, which is called Engaging Illinois. And then also information about the listening sessions that are going on around the state. So if you could promote those to people so they show up. We need to hear from people with their ideas of how we can improve the situation. So I'm sorry I can't speak more eloquently to exactly what the Illinois Department on Aging is doing currently, but this plan is a huge effort that will set a blueprint for the next 10 years. So thanks for letting me talk.
Absolutely. And I'm so glad you're able to join us, Michelle. So you can reach out to Maya or me, and Maya can drop both our emails in the chat. And we'd be happy to spread the word about the listening sessions, because we do have great connections with community orgs that work with harder to reach seniors, diverse communities with low resources, that I think would be important to include in these listening sessions. So yes, we're happy to help with that.
And I wanted to mention, I talked about in California, how we're advocating for a state-based rental assistance program there for older adults. And we're doing that through California's master plan on aging. So yeah, I think these multi-sector plans on aging are really great avenues for advocating for a lot of these solutions.
Thanks, Jenny. All right, I want to move on now to discussing, what resources are available for improving access to senior housing. So most of these questions of mine are directed at you, Molly. So can you begin by telling us more about the Housing and Services Resource Center, HSRC, and what HSRC and other federal agencies are doing for improving access to affordable, accessible senior housing?
Sure, thank you. And I apologize, I ended up with a bad cold, bad timing, but so please excuse me while I wipe my nose. The Housing and Services Resource Center is definitely a technical assistance resource center that everyone should know about and is hopefully using. So it was created back in 2020 by the U.S. Department of Health and Human Services, or HHS, and then also the U.S. Department of Housing and Urban Development. It's since expanded to include other agencies, including Department of Labor, Veterans Affairs, U.S. Department of Agriculture, to name a few. So, and this is the HSRC is how the federal agencies have come together with a shared recognition and understanding that older adults, as well as people with disabilities, if they're going to age optimally in place in the communities of their choice, that requires both access to affordable, accessible housing, but then also a wide range of community services. From our members' perspective, area agencies on aging, we know that home and community-based services are really critical to housing stability. So the HSRC serves as the way that the different federal agencies are coordinating their investments in housing insecurity and homelessness, with a focus on older adults and people with disabilities, both those who currently are housed, as well as individuals who are experiencing or at risk of homelessness. So it's the HSRC is a technical assistance initiative, and the focus is really on providers such as yourselves, as well as state agencies and other professionals, that are working in organizations to address homelessness, housing needs, as well as health and independent living and supportive services in a holistic approach to individuals, recognizing that if individuals are having housing instability, they often have additional unmet needs, such as in transportation, nutrition. They might be at risk of falls. So the HSRC website, which I'll drop into chat here, that is just a great resource for you to find information and tools. The HSRC has a particular focus on, because of all the federal agencies coming together to support the HSRC, the TA initiative really focuses on how do we support communities and states in forming these cross-sector partnerships to also foster community collaboration and, support innovation in the field. So that website has lots of helpful information materials. Jeff mentioned that, as well as Jenny, that many older adults are homeowners. So one resource that I'm going to pop into the chat is an action guide that the HSRC has focused on home modifications, repairs, and weatherization, because often, even if older adults own their home in the clear, they're often struggling with other housing costs, or maybe just have deferred maintenance or have a lot of trip or fall hazards. We know it's a great unmet need. And then the HSRC website is slated for a good number of improvements. And one of those is to make it easier to find past webinar recordings, which I think you would find very useful in terms of, one strategy for better supporting older adults that you're working with on their housing needs is to develop good, strong working relationships with what's called housers or housing organizations in the housing or homeless services space. So to access those past webinars, you need to go to the HSRC What's New page. Once you're on there, you'll see a blue band and it says prior events and webinar materials or recordings. Click on that and that's how you'll see the full listing. Again, we are hoping that that will become more easily found in the future. And then if you aren't, I would encourage everybody to sign up for the HSRC web, sign up for HSRC updates. And so you can do that on the ACL website. There we go. I will say when you click on that link, it will ask you right away for your email, which I don't know about you. Sometimes I'm uncomfortable just providing my email right away, but you need to provide your email. It is a safe federal website. Provide your email, and then you can toggle on your subscriptions. The HSRC updates has been on pause since the early part of 2025, but I believe there's interest and effort to resume those updates. So if you don't get anything for a while, don't worry too much. And then if I could just add quickly that you can learn about some of the work that U.S. Aging is specifically doing on housing and services through our the U.S. Aging website. We're in the process of adding a new resource on older adults and homelessness, so that will be coming out in the fall. So thank you.
Great. Thanks, Molly. And I hope that cold recovers quickly. Thank you for joining us despite being unwell. We appreciate it. So at this point, I want to open it up to the audience. I do have a couple of follow-up questions myself, but I want to give an opportunity to audience members to ask questions or even share comments. So as you're thinking about your own questions and comments, I did have a follow-up question, Molly, if you don't mind. Do you know if there are any federal funding options available right now for local agencies that serve seniors to collaborate with some of those housing providers to address housing insecurity for seniors?
You know, it varies, and I would encourage, you know, the participants today to keep in mind that there tends to be the federal funding for older adults and housing affordability and accessibility kind of tends to come in two buckets. So one is for the housing itself, the bricks and mortar, whether it's building new properties or rehabbing them or providing vouchers. And then the other bucket is for the services. Some of those are like help people find and get and keep housing, such as helping support their tenancy if they're renters. But then there's also funding streams for services. So I would also encourage, and I think Jenny spoke to this really well too, that, you know, don't just look for those federal funding programs, but look also at your state and local options. But in terms of federal funding for housing, the more the bricks and mortar or being able to access bricks and mortar, you know, the U.S. Department of HUD has its Section 202, supportive housing for the elderly. There's Section 811, supportive housing for people with disabilities, individuals, but sometimes tied to the building. There's Section 8. Different Section 8 vouchers and the low-income housing tax credit. So there's a housing-specific webpage on the HSRC that gives you some more background about this as well. And then there is a separate HSRC webpage on a wider array of funding, some of it in terms of accessibility and the different federal programs that are available. There may be a few items that are a little out of date, so I will just mention that, and those are requested to do some updates. But those, I think it's important to recognize that some of those funding streams are open only to specific types of organizations. So it's really important to establish those working relationships with different housing or homeless services organizations. And one way to figure out who, for example, is your local public housing authority, or as well as, let's see, there we go. Who is your local homeless continuum of care? I would encourage you to check out the HSRC directories webpage, which is a collection of links to different directories, both in housing and services. And then finally, I would say, I just hope everyone on the chat knows about area agencies, or in the webinar knows about area agencies on aging, and they are public or private nonprofit agencies that the state has designated to address the housing and a wide range of needs and concerns of older adults at the regional and local levels. So the Area Agency on Aging, or AAA, that's a generic term, and the specific names of local AAAs may vary. For example, in suburban Cook County, Illinois, Age Options is a AAA. So if you want to find your local AAA, I will also directly drop that link to the elder care locator into the chat.
Great. Thanks so much, Molly. And just to add to what you said, our team did do some research, and we've put together some examples of innovative housing models and practices where local agencies, including area agencies on aging, have been able to leverage and braid different funding streams together to create accessible and affordable housing options for seniors. So Maya, if you're able to, could you share that file in the chat? We will also, and there you go. Thanks, Maya. And we will also send this out by email to everyone who registered for the webinar. All right. We have about 5 more minutes before we open up the evaluation for the webinar. So I'm going to ask again if there are any questions from the audience. Or even comments, and you can type them in the chat, or you can raise your hand and unmute yourself.
I just wanted to also mention some states have also been funding supports like housing navigation services through their Medicaid program or through other investments. And just wanted to mention that because I think that's especially important for older adults and people with disabilities, because they usually have a harder time navigating all of these systems. And I think, the federal subsidized housing system can be really confusing for people, because for some programs you're applying to PHAs, other programs you're applying to certain affordable housing properties. And yeah, like Molly mentioned, there are so many programs out there. They can be really hard to navigate if you don't know about them. And so I think those types of services that help people find housing and services and navigate those systems is really important.
Thank you for sharing that, Jenny. Can you tell us a little bit more about what exactly housing navigation services includes?
It can
And folks in the
vary.
audience, please mute yourselves. Thank you. Go ahead, Jenny.
It can vary, but I think the basic idea is that people get more support when they're searching for housing and applying for housing. And again, I think for older adults, especially, those types of services are really essential. And I used to be a legal aid attorney, and I know my older clients, when they were looking for housing, that was a really big hurdle for them.
Great, thank you. And I see that Jeff has shared some information in the chat about a statewide coalition that is working to increase resources for home repairs. So thank you for that. Scott, you have your hand raised. We have time for your questions, so go ahead.
Sure, it's not a question. Something I started when I joined AgeLink, we are AAA, by the way. It's a program called Navigating Senior Living Options. It's where I will meet with families and discuss what the needs of a loved one might have. And then we can look at several options as far as what direction they want to take, whether it be they need independent living, assisted living, memory care, skilled nursing, and then I can kind of guide them to what communities they need to go look at. Now, as a nonprofit agency, obviously I can't make any referrals to any particular agency, but it's been a very successful program for us.
Great, thanks so much for sharing that, Scott. All right, any last comments from our panelists? Yes, Molly.
I have one. This is just wisdom that I'm passing along from AAA's, and I'd be curious if others have found it. But, you know, some of our AAA's have found that often the most affordable housing is where the adult currently is, unfortunately, in this housing market where there's such a scarcity. So, you know, think about not only, you know, different options in the community, but also consider, you know, are there potential supports or assistance that we can help the older adult access and to be able to better afford where they currently are.
Great, and by that we mean like transportation, mental health
Transportation.
supports, right?
Caregiver support is a big one. Yes.
Thank you for adding that comment, Molly. Big thanks to all our panelists. Audience members, please don't leave yet. We do have an audience poll coming up. So Maya, if you can go ahead and launch the poll. So please stay for the next few minutes until you finish the poll. Your feedback and evaluation is really important for us as we plan future virtual conversation circles and figure out where to move this conversation next so we can push the needle a little bit, both locally as well as nationally for housing options for seniors. And once again, thank you so much, Molly and Jenny and Jeff. We really appreciate you taking the time to share this precious 1 hour with us. We know that time is a precious commodity, and we're really grateful to have you with us today.
Thank you.
Thank you.
All right, so for those of you still in the meeting, please go ahead and complete the poll. We'd love to have your feedback. Maya, are you seeing responses coming in?
Yes, I am. I see 16 responses out of the 29 people left on the call.
Fantastic. If you haven't completed the poll yet, please go ahead and do that. We really appreciate your feedback. Thanks everyone for joining us today. We're going to keep the meeting open till 1 o'clock to give everyone an opportunity to finish their poll before they leave. But if you need to leave, thank you so much for being here today.
Okay, I think everyone has responded that's here.
Wonderful. Thanks all. Have a great rest of your afternoon, and we will be following up with all the resources that were shared today in an email. All right, Maya, I think it's okay to go ahead and end the meeting now. This is wonderful.
All right, I will end the meeting.
Fantastic. Take care, everybody. Enjoy your afternoon.